right. Good afternoon, everyone. Get a seat. Well, I'm so happy to introduce our distinguished speaker series in nursing. And we have invited one of our very own alumni, Dr. Susan Hassmiller. She is a national leader in nursing, health equity, and leadership development. She has devoted her career to advancing and advocating for nursing profession, improving population health, and achieving health equity. During her 25-year career with the Robert Johnson Foundation, she served as.
I have a meeting with a student at 1.
Sorry,
Or 1:30, but I can go
Related
down.
to diversity, equity, inclusion, and accessibility. And the
I'm
Secretary's
gonna move
Council
that
is
appointment,
supposed to meet
can everyone mute?
twice a year. There is a Deputy Secretary Council, and that council is supposed to meet quarterly basis. And then each octave is expected to have a diversity council. And the diversity council
And I try to mute them.
is our diversity, inclusion, executive steering committee. So we were way ahead of the ball in terms of making sure we had a council set up. Now, the members of these councils are consistent for the most part across the board. You're going to have the secretary, of course, the secretary. You're going to have the deputy secretary.
All right.
So make that smaller.
Yeah. Hide non-video participants.
Beautiful. Okay.
Perfect.
So we're hidden.
Yes. All right. Back on track. Dr. Susan Hassmiller has served as the Senior Advisor for Nursing for Robert Johnson Foundation, a Senior Scholar in Residence, and Senior Advisor to the President at National Academy of Medicine. She helped lead both landmark reports at National Academy of Medicine on the future of nursing, including the 2010 Future of Nursing, Leading Change, Advancing Health, and the latest report, the Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity. She also established and served as director of the ongoing Future of Nursing Campaign for Action, a national 50-state collaborative in collaboration with AARP and the AARP Foundation to transform health and healthcare through nursing to build a healthier America. Dr. Hassmiller has held national leadership positions in the nation's most prominent healthcare organizations. She served on the board of governors of the American Red Cross, is an elected member of the National Academy of Medicine, a fellow in the American Academy of Nursing, where she holds the living legend status. She is the recipient of many awards and 4 honorary doctorates, but most notably the Florence Nightingale Medal, the highest international honor given to a nurse by the International Committee of the Red Cross. In addition to her career in philanthropy, Dr. Hassmiller has also held roles as a frontline and public health nurse and has worked in public health settings at the local, state, and national levels. She taught community health nursing at the University of Nebraska and George Mason University. She now serves as a Hudson ICF certified executive leadership coach and founder and principal of Sulu Coaching and Consulting, with a practice focused on serving healthcare leaders. With that, without further ado, Dr. Hassmiller.
Thank you. Okay.
Oh.
So this is a small enough group. I think we should, I should know who is in this room. So I still will stand back here because I have some notes back here. But so can you introduce yourself tonight?
Sure, Leanne Barfield, the Assistant Dean of the Graduate Programs.
This is the graduate program.
Katie Lambert, Clinical Coordinator. And Brittany Stover, Academic or Administrative Assistant for a few more days.
Oh,
Yes.
you're moving on.
Yeah. I didn't need to add that. So.
Should we discuss this?
I just didn't want you to get used to me.
All right.
Hi, Linda Higgins. I'm on the Knoll Nurse Alumni Council, helping all kinds of ways.
Okay, well, good. All right, well, I'm an old nurse.
Yes. Hi, April Lovett. I am working on FSU's Health Data Science Initiative.
Oh, okay, yeah.
Lisa Haito, I'm a new faculty in college nursing.
Caitlin Sick, also a new faculty in prevention nursing.
Nice to meet
Marsha Hartline, new associate dean for student affairs.
Steve Palazzo, new assistant dean for undergraduate programs.
Wonderful.
Janet Kisner, for faculty development and advancement.
Oh, great.
Hi, Susan. We met earlier. I'm Ally Craig Rodriguez, coordinator for the FMP and the Lifestyle Medicine track.
Susan Baker, Associate Dean for Academic Affairs.
Jessica Robertsby, assistant professor.
David Thomas.
Yeah, and guru. Nutrition guru. Yeah. Okay. All right, so just so I normally do this after, but I'll do a spoiler alert. Because I when I do this presentation, lots of times I'll ask afterwards, and I'll have lots of students, so I generally try to pick on them. But I'll ask, okay, of everything that you heard, what most resonated with you? So I'll ask that. So I'll try to whip through this quickly because there's just kind of a small group, and then maybe we can just sort of welcome. And then we'll, any questions are welcome, small enough group, if you want to stop me in the middle, whatever, but I'll just kind of run through this. So I'm obviously very thrilled to be here. I graduated from the School of Nursing in 1977. I'm a very old person. Sally Carrioff had just finished her PhD or something. She's brand new faculty. So I had Sally Carrioff as a professor, if you can believe it. I'm sure she was not a professor. She was like whatever you start out with, right? And so I was part of a very small, special experimental program that was called the Curriculum of Attainment. I think I was telling Jing that I think we were the only class, but it was advertised. Remember, there was no internet, no social media. Who knows how I found this, but I found that Florida State University was going to have a special competency-based program for, get this, mature, experienced RNs to come back and help design their own curriculum to get them through to a baccalaureate degree in however much time it took them. So people came into the class, they were collecting students, potential students. Everyone was mature and experienced. They were in their probably upper 30s, 40s. I remember there was like a 50 and a 60-year-old. Maybe there were 12 people in the class. I don't know, but I was like 20 years old. And I came to the dean's office here on the first floor. And I said, I'm here to sign up for the new program. And she looked at me and she held up the advertisement. She says, I believe this says mature and experienced, young lady. And I said, but I know I can do this. I know I can do this. You're not who we're after. But anyways, I stayed in her office long enough so that she got sick of me sitting there. She admitted me to the program, and the rest is history. So anyways, so thank you for having me here. I love being here. So let me just, so I learned FSU is a leader in advancing health equity from the $14.5 million grant you received from NIH. And now I understand there's new money possibly coming into the university, which I am really happy about. Yes, I'm glad that the dean is one of our Robert Wood Johnson Nurse Faculty Scholars, and she's also on the board of Robert Wood Johnson Foundation. So a lot of connections. We've all been through a lot, the pandemic. So, normally I thank everyone who's been at the front lines, but faculty and students, it was a very difficult time. I know for faculty, you had to come up with new ways of teaching, and it really pushed everyone to the absolute limits. So I thank you for everything that you did here. This new report, I think the book is right there. The new report on the future of nursing arrives at sort of an inflection point for our nursing profession. The past 3 years have increased nurses' visibility, but it's certainly come at a cost. And as I said in my presentation in the big hall, I know not everybody could hear, but you know, this pandemic certainly didn't affect everyone equally in our country. Most people who ended up dying were Black, Brown, Indigenous, and the elderly. So it was very inequitable time for us in this country. This report is the second major report. How many people remember the first report? It was released in 2010. Thank you. A+, 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 A+. It was released in 2010. And I had the great honor of going to the National Academy of Medicine for both of these reports and help lead these efforts. And if you know anything about the National Academy of Medicine, it was the Institute of Medicine at the time. They produce a lot of reports, science, engineering, you know, medicine. And you notice our book is called The Future of Nursing, and they sort of have like a New York Times bestseller list every year that comes out. And as soon as the first book came out, this one here, as soon as the first book came out, it was like, it went to the #1 slot. It's like something really unknown, if you can imagine, going right to the #1 slot. And it stayed there, a nursing report at the National Academy of Medicine. It stayed there for 11 years until the new book came out. And now the new Future of Nursing book is #1, and this one is #2, with as many fantastic reports that have ever come out of this place. You know, and after like a couple of years, and it was just kept growing and growing, and I went back and I said, who's buying this thing? This is like amazing, like millions of copies, right? I get nothing out of it. It was just, you know, if you know anything about the National Academy, you just do, and you do your sweat equity, and you do all this stuff. And but it was nurses and schools around the world. So this has gone around the world many times over. So I'm really happy about that. You know, and why is this next one so important? Charting a path to achieving health equity. Well, because of this. We are, you know this, I'm speaking to the choir, but you may have not seen these exact statistics. You know, for everything we spend, how can it be? How can it be that we in the United States of America are last? Is the craziest thing you've ever heard, right? People are stunned. How can we be last? Because everybody's used to all these gadgets and machines that we have and all this glitz and glamour of medicine. But that has nothing to do with population health, right? Keeping the masses healthy in a fair and equitable way. That is what we, quite frankly, stink at. Did that word stink come up there in the closed caption? Yes, good. You can quote me on that. So, but we also knew that nurses have a very long history of tackling the many social and economic drivers that affect health. Last week, I was so privileged to spend the week in New York City, where we did kind of Christmas stuff, you know, it's the tree and ice skating and all that stuff. But we also did a tour of the Tenement Museum at a time when public health nursing was just starting. And they talked about the settlement houses. And I asked our tour group, you know, I was just a participant, right? And I said, anybody here of Lillian Wald and the settlement houses? So the tour director had heard of Lillian Wald, the mother of public health nursing. And of course, she is the one who really paid great attention in New York City to the social determinants. She knew that if the kids were in school, the father was employed, and it was the father, right? The father was employed. They had a stable roof over their head, and a way to get around and food on their table. Lillian knew, Miss Wald knew that her population would be well. It had nothing to do with like health per se, but it's so linked. It's so linked, and people don't understand why we are last, and it's because we don't pay attention to those social determinants in the way that other countries do. So achieving health equity is the most salient issue of our time now. I really believe that. And this is nursing's time. I tried to stress that point in the big auditorium. And you know, here's what Lillian paid attention to, and this is what we need to pay attention to. And I'll talk more about that as we go on. So inequities. Anybody in here ever hear of redlining? Yeah, it's kind of bad, not kind of bad. It's very bad. Redlining really has a lot to do with the structural racism that we see in our country now. It was used throughout the country, started in the 1930s and 40s, keep Black people restricted to certain areas that lack social and economic resources. And I couldn't find a map of Tallahassee. This is a map of Jacksonville. I got lots of wonderful noises that are coming out of. Don't touch anything though. I'm really all set. The last time somebody touched it, it was like we had to start over. Okay, but these maps were produced all over the country. By whom and for what purpose? For banks. For banks. So the map was produced by one of the New Deal's most important agencies, the Homeowners Loan Corporation. So these, it doesn't bother me, as long as it doesn't bother everybody else. I'm hearing like little kids and babies. So, but banks and loan corporations use this as a guide as to whom to give money to. Can you believe it? Now I hear a dog, but it's okay. I'm still okay. These structural, it's okay, really. These structural inequities and racism experienced by people of color on a daily basis lead to stress. This is all research evidence, you know, we know this. Lead to stress, poor physical and mental health, and the advent of chronic conditions sooner than among white people. And this, of course, is what put Black and brown people at risk during COVID. Low-income individuals, people of color are more likely to live in crowded housing, rely on public transportation, social distancing. We know that, and we know that that was the clincher for them. The brutal killing of George Floyd by police officers. You remember George Floyd now. I hope it's not too in our distant past. I hope we continue to keep these examples in front of us, actually. And the unconscionable long list of Black Latino victims who preceded him and came after him, as well as, you know, we talk a lot about Black and brown people, but what happened in the pandemic as well. And this is a very old number. This is an old number, but the over 6,600 reports, I'm sure it's probably over 10,000 now, 6,600 reports of hate incidents against Asian Americans and Pacific Islanders, right? During COVID, because of the blame factor. Oh, you know, it was all about blame, right? So this report is intended to meet this moment that we've had, everything that's happened to us in the country. It contains 4 key takeaways and a series of recommendations to unleash the potential for nurses to achieve. Yeah, I don't know where that
you can't go into my first without asking, okay?
You want to come up and do it again? I can speak louder than who's ever speaking there. So, but there must be somebody in a closet somewhere.
Yeah, just everybody mute your mics if you can hear us.
Oh, mute your mics.
Or yeah, mute your computers. They just need to mute it on their end.
No, it's not letting me. It's not letting me.
Okay, it's okay. Make that smaller again. Yeah, I'm okay. Maybe mute that.
No, that's you.
Okay, okay.
Let me see.
So the report, yeah, so here's, you know, you saw me hold it up. Hopefully some of you actually have this. I mean, they do, I don't get anything out of this, believe me, but they do sell these at the National Academy of Medicine. They also, you can also print it for free, but 57 recommendations in here. And with any National Academy of Medicine report, it's an extremely stringent process whereby, I mean, really the windows are shut, the doors are closed. There is a special committee of national and sometimes international experts that come together to actually begin to gather the evidence and make recommendations for the proposed report from the funder. And our funder was fortunately Robert Wood Johnson Foundation. That's it. The report calls on the systems that educate, pay, and employ nurses to do the following: permanently remove barriers to allow them to do this work. Those of you in the nursing profession know all about that. Value their contributions, prepare nurses to tackle and understand health equity and to fully support them. And the need to dismantle structural racism and diversify the nursing workforce is woven throughout the entire report. When it comes to education, I'm in an educational institution now, but writ large, we did so much surveys, research to get down to this book and these recommendations. Schools of nursing are not doing the best job in the world nationally, right? Nationally, to educate students about social determinants and health equity. But I'm thrilled to see how FSU is making health equity its North Star. That makes me feel really proud as an alum. Let me see. Get my cursor here. There's so much going on the screen in front of me, you wouldn't even believe it if you saw it. And I can't, there we go. Okay. I just used my finger, I lost the cursor. So the future nursing graduate will need to be better prepared to understand and identify these social and environmental factors that affect health. I know in schools of nursing, we do everything we can possible so that everyone passes the NCLEX, right? And some of these other concepts really get put to the wayside, and which is the way it is, but these are some really important concepts that we need to bring into all parts of the educational experience. And here's an important thing that I harp on all the time: collaborating with partners outside of healthcare. So in the first report, we made a very big deal of talking about a lot of things, but interprofessional collaboration, how important interprofessional collaboration is. You know what? We've got that. If we don't have interprofessional collaboration by this time, we might as well hang it up. So we didn't focus much at all on interprofessional collaboration, although that's still very, very important. Now, the new name of the game is multi-sector collaboration, because if we're going to pay attention to those social determinants that really affect the population's health writ large, if we're going to pay attention to that, we got to get out of even healthcare. We gotta start working with those organizations that represent housing and food and transportation and social connectedness. That's where the action is for nursing. Nursing educators have tremendous potential to impact health equity. They can integrate the social determinants of health and health equity into nursing education. And FSU, I really believe is doing that. We can all improve. Let me see if I can, okay. So nursing educators can also teach their students to connect with people of different backgrounds and be self-reflective about how their own beliefs and biases affect the care they provide. Cultural humility and implicit bias can be interwoven throughout the curriculum. So, with all of this work on health equity, so for some of us in the room, this is like new material, like structural racism and health equity. For other people in the room, they have lived this their entire lives. So this is a time when I think both sides, all sides, need to listen to each other about what really matters in terms of health and well-being and a person's value in schools of nursing, and then once they get out. The new report unequivocally states the nursing field needs to address systemic racism. Of course, we talk a lot about that in the report, and prioritize diversity and cultural humility. Go beyond that. For too long, the nursing profession, and I know I was very proud of this, but for too long, the nursing profession has taken on the mantle of being colorblind. We don't see color. And I was always very proud of that myself. But that's not really the right way to go now, because if we don't see color, then we're not paying attention to the things that are really important now in terms of health equity. Lavoria Williams, a nurse educator at the University of Kentucky, urges us to do better to help our students face the reality of racism and other social determinants of health. Medical bias is very, very, very real. I can tell you that, and a very important thing to address. Nursing schools can take specific steps to recruit and support nurses from diverse backgrounds, including geographically disadvantaged students. And I know that Florida State is making great strides with this as well. Nursing schools can make sure that all students feel included and welcome. And it's interesting. We don't always want to acknowledge, I don't even like the word, this bullying thing. I don't even like to use that word. I mean, we heard a lot about it before the pandemic, but there's a lot of that goes on in workplaces, in schools of nursing. We're human beings, so we're always looking for one-upsmanship. And when we do that, it's like another person has to be below. And so just being cognizant, we know that this does happen. It's not a maybe, it's not Florida State, might or might not. Everybody has this in their university, and we just have to be open to acknowledging that and being welcoming and open with, and that means having crucial conversations too, being open to having those conversations. The report identifies 8 skills and competencies that all nurse leaders, and I would say that any leader working in the space of health equity should have. So let's just say nurses and others. Nurse leaders in academia and practice need to help more students to develop and expand these leadership competencies. So you see here, having a vision, you have to have that as your North Star. You're not going to get any place unless you really take that seriously and you really have that as your North Star. And then you see the second one is the one that I was talking about, so important, leading multi-sector partnerships. You can lead it, you can be part of it, but get out there and do it. Leading change, innovating and improving, teaming across boundaries, creating a culture of equity, creating systems and structures, and mentoring and sponsoring. So, in schools of nursing, we did a nationwide survey. We looked at schools of nursing, and a lot of schools, even if they say they're incorporating education around health equity, social determinants, racism, we found that it's like tucked away in the community health course, right? And if health equity is your North Star, then it can't just be tucked away. It has to be a thread. It has to be who you are, what you're living, what you're teaching, and that's what we have to do. I put this one in here because it's so important, and I know that FSU is getting ready to embark on a new PhD program. So important. I'm happy that we have DMPs in this country. However, if you've ever looked at the trend lines in nursing for nurses who have a DMP versus a PhD, knowing that those with PhDs are really the scientists and the science and discovery of our profession, and really builds the knowledge base for our whole profession. PhDs, nurses going into PhDs are like this. And sometimes it dips down. DMPs are like this. Everybody going back for a doctorate is getting a DMP, right? Again, happy about that, but they are the facilitators, the implementers of the science and discovery, right? So I always, yeah,
Sorry, do you mind?
no, do it. We're a small group.
It's a small group, so, this has been something personally that you're gonna be crazy with the years, of course, because when this all started, not anything personal with these, of course, it just, the emphasis was placed on the DNP getting more doctorates in nursing.
Yeah,
And so they really pushed the DNP while neglecting the PhD.
totally
Many
neglected.
people were calling, and predicting, myself included, that this was gonna result in a flatline or decrease in the PhDs.
Already has. It's not resulting, it has resulted.
Well,
Yeah.
that's the pay differential too, between the two, and the things that go behind it, but so now they're addressing it and calling for it. What is actually being put in place to support that drive to increase the number of PhDs in the profession? So it's one thing to call for, but what is the activity that's happening that's going to do this for us?
Yeah, are you asking me?
I'm asking if you have any insight. Yeah.
Well, I
have the
mean,
answer.
you know,
If you have the answer,
I
then-
think you, first of all, you have to have leadership at your school of nursing who really understands this and supports this, which is what I'm finding. But the sort of like the drivers and the influencers in our profession are so strong for the DNP. And a lot of people come in and it's a moneymaker for universities. I'm sorry to be blunt. And it what was I gonna say too? The federal government, I was telling the dean earlier that the federal government has some money for diversity and PhD faculty that you might need to look into. So something like that. And Robert Wood Johnson has been very instrumental because I feel it's so important in getting PhD scholarships out there as well. So it has to be something that comes from leadership, supported by the university. We've got the university supported, represented over there. And I'm so glad to hear that my alma mater is going to be starting a PhD program. That makes me feel really proud. So the pandemic has illuminated how poor, because we're sort of in and out here, and I'm being formal but informal at the same time. Could somebody watch the clock? So probably, how many minutes do we have? How many? We have 25 more minutes? Okay, I just want to make sure. I didn't know if 25 or 5. I could really modulate based on any of those answers. But anyways. So the pandemic has illuminated, of course, how poor and marginalized communities are disproportionately affected, but also by disaster. So I'm a big Red Cross person. I have my Red Cross pin on here. I got my Red Cross start in Tallahassee because it was at the time that I was a nursing student that the Red Cross helped me find my parents who were in an earthquake in Mexico City. I'd never heard of the Red Cross. What? I dialed 0 for the operator because I was watching TV one night, earthquake in Mexico City. Some of you who are younger, there's just like nothing. You had your dial phone in your kitchen. I had a yellow dial phone. I dialed the operator. My parents were in Mexico City. The operator said, "Oh, I cannot help you, but I know an organization that can." She clicked me over. Some of you won't even understand those words. But she clicked me over to the Red Cross, who helped me find my parents. And then I came back to school here. I was like on spring break. I came back to school here. And I must have looked it up somehow. I don't know how I did these things without internet, but I must have looked it up somewhere in the library. That's how you used to look up stuff, even addresses. But I headed over to 924 North Gadsden Street, 924 North Gadsden Street, drove my car, and I went right into that Red Cross office and said, "You help me find my parents. I'm here to do whatever." So I've been very involved intimately, and still I'm very intimately involved in the Red Cross. But that when disasters happen, who's most affected, right? People like me, a hurricane is coming, even a tornado. I know how to get out of town. I have cars, I have people, I have plane tickets that I can buy. the people that are affected by disasters are the people that we're talking about. Brown, Black, Indigenous, poor, elderly who can't move, right, disabled. Those are the people who are really horribly affected by disasters. And I really try to promote, you know, if you don't have much of a partnership with the Red Cross, I don't know the current strength of your Red Cross in this particular city. But if you don't have a partnership with the Red Cross, I would really recommend that you do that, because there are academic service partnerships that we are promoting now. And they were really helpful during the pandemic, because the Red Cross did not close down during the pandemic. Surprise, surprise. There were still disasters that went on. We just had to do it in very different ways, and very good experience for students. The report also stresses the need to fully support nurses. The pandemic has been challenging, as I said this, for nursing educators and students. I am just incredulous at what the faculty and the students had to go through during the pandemic to ensure this class that we just congratulated, right? This was your first class that came in during the pandemic and ended during the pandemic. You know, I'm sure they feel less adequate in a lot of ways because they didn't get some of the normal experiences other students did. They'll be fine in the end, but they'll certainly have a lot to tell their grandchildren. The other piece is that nurses in practice are struggling, of course. There's a dearth of experienced nurses as my generation retires, and many new nurses struggle to come up to speed, and nurse retention is a big problem. So here's a bit of news. This has not even been published yet, but I have permission. Peter's a very good friend of mine. So sometimes I beg him, can I just show one of your slides, even though it's not published yet? Kate, have you heard of Peter Beerhouse? He's a big nurse economist researcher in our field. So when the pandemic started, I brought him on as a researcher with his team, Harvard and University of Montana, to track nurses during the pandemic, so we could see what was happening, not only the rate of burnout, which we already know, but his specialty is workforce, who's in, who's out. And you can see, here's the line here. Let me just see if I can see. There's 2020. So total RN supply dropped in 2021 by nearly 200,000, below what had been forecast. So we lost a lot of nurses. Here's the big news. This is big news. I've only said this the second time, and Peter has said it. It hasn't been published yet, but just this past year, and he's going to take the data throughout the end of 22, there has been now a bump up. So what that means is more people are coming into schools of nursing than ever before. So we have people coming in. It's an issue still keeping them and making sure they feel valued, both in the education realm and in the clinicals. But nurses have come back. Remember, most nurses are women, so they had to go out, they had to do homeschooling with their kids, right? They had to take care of their parents, they had to take care of their community, they didn't want to get people sick. So a lot of nurses went out of the profession during the pandemic. Here's the big news. The big news is this: nurses have come back, but not to hospitals. So hospitals, acute care facilities still have shortages, some very acute shortages. You know all about the travel nursing issues and how budgets have been thrown under the bus. But nurses have chosen to come back, but not to hospitals. Okay, so that's the big news. And that has never before happened in our country. So schools of nursing have an important role to play, equipping students with resiliency, everything that I talked about. So they're coming back now. They're coming back, but we have to be so very protective, as I know you are. Getting them here is one thing, and especially first generation students, Black and Brown, Indigenous, even disabled, bringing them into schools of nursing and making them feel welcomed and valued and supported. That's the critical part. And even when they get into workplaces, that structure of support still needs to be there. And hospitals are finding out the hard way. They have found out the hard way that this is what they need to do. It's not all about money, right? We have never done one research study in this country ever that has shown that nurses, number one thing is money. We don't go into nursing in the first place. It could be 2 or 3 or 4, but it's really the ability to work in a safe environment, to have the support they need, to have colleagues that have their back. That is and to do their job. They just want to do their job. And schools of nursing can also conduct research on well-being to find which solutions work the best. I think there's a lot of scrambling around the country still. There was so much scrambling during the pandemic. What do we do to keep people? And they were just leaving in droves. And now they're coming back, not so much to hospitals, they're coming back now, but now how do we keep them? And more research needs to be done on how we do that, because it's a valuable commodity. The report includes a number of recommendations to create structural and cultural changes to fully support nurses. The main one is that nursing education programs, employers, nursing leaders, licensing boards, and nursing organizations must initiate, this is like one of the big recommendations, all of those organizations must initiate the implementation of structures, systems, and evidence-based interventions to promote nurses' health and well-being. Because when we promote the health and well-being for all, then we have our big chances at keeping them in the profession. There are many ways to get involved in advancing the recommendations for nursing educators. So I've just listed some of the things here. Developing competencies to advance health equity. You know, as I said before, you're not going to do any of these things unless health equity is your North Star. That's got to be the overall arching way that you decide to go. And then you fill in the blanks with these other things. Developing competencies to advance health equity, initiating dialogues about racism and inequities in your classrooms, those crucial conversations, and mentoring and sponsoring students from underrepresented backgrounds in nursing. And always be ambitious and creative. Our forefathers, our foremothers in nursing and in healthcare, and in any field. The way that we move a field forward is we just have to be courageous and be innovative and not worry about doing things the way they've always done, because that has just not worked. For the administrators, we have a lot of administrators here. You can create policies and regulations to protect students most at risk for behavioral health challenges. And I love the center that you have. What is it called, Jing? The support services? Student success. Yeah, I think that's so important, right? So you should ensure that all students can engage in virtual learning, can identify and eliminate policies, procedures, curricular content, and clinical experiences that perpetuates structural racism, cultural racism, and discrimination among faculty, staff, and students. And, to some people, it's like, what does this mean? When you're telling me to eliminate structural racism policies, that's a discussion that has to be had at every organization, schools of nursing, places where nurses work. Those are the very important conversations that have to be had. And that's very, very, very hard work. That means looking at sometimes policies one by one by one. Is this Is this discriminatory? Is this going to value our students? But it's very hard work. And the report includes a comprehensive list of research topics that are needed to advance health equity. And I listed some examples there. FSU, love it, great research university. And my hope is that the faculty and PhD students will pursue research in these areas. And then last slide, I just want to tell you the story. The very first, this came out, was supposed to come out in May of 2020. Well, where this nation was in May of 2020, right? Right. And we hardly had anything in the book so far. We didn't have anything in the book about the pandemic, COVID, and how this pandemic had affected certain populations in our country. So we almost had to rewrite the whole thing within the last 6 months. And we could not send this out in good conscience when we were supposed to. We would have been, it wouldn't have been paid attention to. And now this is all about, not all about, but we've woven in COVID and everything that we've needed to weave in here. And when it came out then in December of, I'm just losing track of my time. My God, when did this come out? Does anybody know when this came out? Anyway, when it came out, the very first presentation that I gave, everything was virtual, right? I've given so many virtual presentations, but the very first presentation I gave was to a nurses group called Nurses on Boards Coalition, a group that I started a number of years ago that has really caught on big time in our country to get more nurses on boards, and now on boards of those organizations that represent the social determinants. But I did that, and this was so meaningful to me because Martha Dawson, who is still the president of the National Black Nurses Association, she raised her hand after, and it was my inaugural presentation on this, and all she said was, "Sue, I've been waiting for this report for 44 years." And that was like the best thing anybody could have ever said to me. So the next decade offers a lot of challenges, a lot of work to be done here, not just here at FSU, but all of our country with our profession, amongst all of the health professionals working together, because it will take all of us working together to address those inequities that I showed you in like slide 4, like we're at the bottom of the list. So the National Academy of Medicine website, if you haven't gone there, everything is free. You can bring it into your classroom. So I would spread this word. I know there's a lot of faculty not here, but we have put together other presentations that have to do with different chapters on education, on leadership. We have a podcast series. Christmas is coming up. The holidays are coming up. If you want to send somebody a virtual holiday gift, send them the podcast series from the National Academy of Medicine. They might really like that, right? We have policy briefs, so that if you want to change your policies, and this is really kind of thick to get through, we have all the words that can help you, all the big fancy words that government officials get enamored by, we have all of that for you. And the report can be downloaded for free, and the recommendations, chapter 11, 57 recommendations. So that is it. I sort of wove in between formal and informal, and I'm very happy to be here. So now with the spoiler alert, how much time do we have, David? 8 minutes. So I'm going to ask, there's a lot of information. There's some information I even left out because I kind of strolled into other areas, like I told you about my parents in Mexico City. But of everything that I sort of talked about here today, in a fire hose way, what resonated with you the most, do you think? What resonated with you? What do you think that needs to come more into my great School of Nursing Florida State?
Think how nurses are going away from acute care settings that
Yeah,
are coming back, and it makes me think hospitals aren't going to go away, and people that need to be in hospitals aren't going to go away. So what do we need to do to sort of bridge that? And as a whole industry, do we need to start looking at more acute care in the home setting? If people are gonna be there to help support those things, so.
yeah. I was actually glad as a public health nurse, I was glad to see that more nurses, and there was a grant that the federal government, one of the COVID grants that came out. There was money in there for school nurses, which I was thrilled about. School nurses are just such a, you never hear about them, and they went through hell in this pandemic. They were screamed at by all sides, you know that, right? From the parents, from the kids, the administrators. So I was glad that we have a bump up in school nurses. But yeah, that's interesting. Yeah. What else? Yeah.
Well, I think, coming from the perspective of the engagement program, really looking for a good model, a good framework for health equity to guide the program. And infusing that population health throughout, like we discussed, that's like as presented, it's going to be very important for the nursing coming up in the next 10 or 15, 20 years. And also bringing that perspective of science and discovery into the curriculum, so that we have students that are also questioning, but know why they're questioning and some of the processes to get answers for that question.
Yeah.
So nurses are not just saying their problems, but they're saying, here's some solutions, here's some questions we have to ask, investigate, gives us some solutions for these things. How can we be a part of it, even at the undergraduate level, and be on those committees and those board meetings and the hospital planning committees and things like that, where they start just I would like the students to come away with a really well-rounded perspective on how health equity impacts the populations they're caring for, the questions to ask, that they can ask those questions. What does it mean to ask those questions? They have some kind of exposure to that.
Yeah.
Yeah, and really, and we are moving into this more population health focused. Finally, again, coming back to the roots of nursing, we'll circle back to population health, and we're seeing that the care is being provided more and more outside of the acute care setting. And so students need to know how to provide that type of care, which involves more teaching for clients and families, and be prepared for that, because we still tend to teach that traditional hospital-based med surg model. That we just have a really hard time letting go, and for a variety of reasons. When one of our national exams really focuses on that, it's hard for us to switch and address all of these things, because we're trying to prepare students to pass a certain board exam that focuses on a lot what's not on here, to some respects.
Yeah.
So,
So the University of Pennsylvania has this like wonderful President's Award, right? It's the President and Chancellor's Award of the whole College of University of Pennsylvania. And it's a competition university-wide, open to students. And a student, I'm trying to get courage and innovation here. I don't know what you have here, but I love what they have, because there's a competition and any student across the university can apply. They can propose it's a community project, right? A community project that meets the mission of their university. And a number of times a nursing student has gotten it, because they're very mission oriented. I'm just wondering what kind of collaboration and big ways the university has of engaging this topic of health equity.
We have a Center of Population Sciences for Health Equity located at College of Nursing, but it's it's very interdisciplinary. And the award is in collaboration with medicine and psychology, and even
That's fabulous. Yeah.
across like social work and other colleges. We have the Innovation Park where the centers and institutes are located, and they're all across the board. We have the new Institute of like Digital Health and Innovation. and we have innovation hub at the university. So I think there's a lot of like pockets here and there that we actually feature health equity as one of.
So you have a stronghold right here in the College of Nursing.
Yeah.
That's awesome.
And we're also collaborating with the college, Jim Moran College of Entrepreneurship, where their undergraduate students and our undergraduate
Okay,
students
that's right. That's what
are
I'm
working
talking
together on pitch competitions. And they go to the entrepreneurship competitions. Their students are evaluating our pitch competitions. So it's really helping to engender a sense of innovation in nursing. And
That's
it's a great
fantastic.
collaboration that we're having.
That's fantastic. So any other questions or comments or anything?
We have
We're good.
one question in the chat. Yeah. The question is, how can we empower our nurses to improve the culture and work environment? Improve culture and work environment.
How can you empower nurses? Yeah, I think the work environment, so I think. That's a tricky question. You know, there are unions. I'm not a big fan of, sorry, but I know they have their place. And actually, most nurses are not represented at all by unions. I think it's like 17% that you hear about that, right? But it is an example of nurses sort of taking charge of their own profession and getting involved in the policies, because nurses complain a lot about things being done to them, right? Things are done to them and they don't have a voice. So if nurses really want to get out of that, they have to understand that they have a voice and a role. If you want, it's not just nursing, it's anything, it's life. If you don't like something, speak up, and speak up in a respectful way, in an intelligent way. But you have to get involved with your own voice and support each other. Sometimes nursing students ask me, how do I get to be a leader? Like, oh, okay. It starts with their passion. It starts with a passion. You all know that. This is your business here. But helping these students keep their passion alive and
The AC, sorry.
Oh,
So
okay.
aggressive, sorry.
there's a lot of sound effects in this. There's a lot of sound effects.
Thought it was a tremor.
Air conditioning, but it's good. So I think what we're gonna do now, because I think we're out of time. One more question.
One more question.
Yeah.
Okay, it says, thank you, Dr. Hassmiller, for your passion for nursing. It was a wonderful presentation. So much for us to do and with science and discovery. What are your thoughts on encouraging our young students in high school to consider nursing?
You probably have, don't you have a program here to get high schoolers into nursing? Do you? Or do you have a program here?
Not yet, but we're working on it.
Heard of things like the summer camp, right? Camp where you bring high schoolers in. There are definitely ways of engaging with the community. Classrooms are always looking for people to come and speak. There's this one person I'm coaching now, and now I'm doing executive coaching, which is like very exciting. But I'm working with somebody now who is in charge of the program nationally. And she has started what we used to have when I was much younger, like nursing clubs or medical clubs, right? Where people can join in high school. But she's really taken it a step beyond, because not only is it a place where students can learn, but they bring mentors in, and they actually can do some practice, out in the community. I mean, we know that we're all human beings. We want to be engaged. We want to be involved. So the more you can involve students, kids very early on, it's impressionable to them. And if they have great role models, and they have to see people who look like them too, right? That's really important if we're serious about that North Star. So, I didn't realize we have a crowd virtually.
Yeah.
Oh, that's right. Oh.
Yeah.
Oh. We're used to that stuff now, right?
We're talking about reaching, stimulating interest in nursing.
Uh-huh.
And it really starts a lot of times in elementary school. to
Yeah.
Start that fire. So it's really an initiative that David and I talked about, and Caitlin and some others. Having our own sort of transportation minivan equipped with medical something.
Oh, kids love that, don't they?
Going into.
Idea.
We didn't talk about that. And doing this.
Breath for everything.
So,
Yeah. So this Christmas, I'm gonna give my 9-year-old granddaughter my stethoscope. Now, I hope she thinks it's as big a deal as I do. No, I'll have to let you know, but I was waiting for her to get a little older. But it's a way to involve her. We'll listen to the heart together. I hope this all works out. All right, so we're gonna do a raffle, right? So I'm gonna raffle this book off. It's a very expensive book. I get nothing for it. But I actually do have a couple of new books coming out that you look for. And they both have to do with an application of this book. So it'll be an application for schools of nursing. So are there, oh yeah.
Wanna-
All right, so here we go. So look at your number. I feel like I'm on a carnival here. Okay,
In the
ready?
wheel.
Whoever has it, I'm gonna autograph it. All right, here we go. Oh, no, wait a minute. Okay, ready? 702334. All right. Okay, I will check your number.
it's true, because I'm 335. Change seems to be at the last minute. Sure.
Okay, well, it was a real pleasure being here virtually. Love your dog, your kids. And being here, of course, and you know, sometimes you can have me back again. Or being here. Thank you. Okay.
I did.
Right here. Oh, you got-
Oh, here's a pen, okay. An official FSU pen.
Even better.
Oh.
No.
Okay.
Yay.